Thank you. Hi, everyone. I'm Justin Marson, and let's talk a little bit about LiDAR. I have no relevant disclosures. So, I don't think I have to convince anyone here that energy-based devices, lights, and lasers are fantastic tools for patient care. But for people not in the know, I want to switch gears and talk a little bit about light and detection and ranging, also known as LiDAR. As a type of technology, it uses a system. It sends a laser out, measures the time to go out, to come back to a sensor, and using that information creates a 3D model. For those in the know, it's most commonly used in autonomous driving vehicles, but in 2020, Apple introduced the technology on the iPhone 12 Pro. So why is it potentially clinically relevant? Well, I'm sure everyone here has had at least one procedural referral where a patient came in after a biopsy. You can't find the lesion. You can't find the scar. All you get is a grainy image, maybe some deficient reports, no triangulations. Now you're in a bind. What can you potentially do? So we were considering, potentially a 3D image taken by LiDAR can help address this issue. And if it can, what other domains in dermatology might it be able to do? So to address this, we used a mock patient, i.e. me. We took a scan in under a minute using an iPhone 14 Pro. We took a survey. We sent it out to the Mohs College as well as some residents and fellows. And we asked them about their practice demographics, about their current pre-surgical assessment protocol and what they do. And we also asked them to compare traditional 2D photography with these 3D scans in terms of usability as well as interpretability using a 5-point Likert scale. On the left, you'll see the 2D photograph that we sent. On the right, if you can capture that QR code quick enough, you'll be able to see, and I'll hold it for a bit, go back. Go back one more time. So you capture the QR code, you'll be able to see the 3D model that our participants were able to see. And in case you weren't able to capture it, that is a rotate. You can rotate it, you can zoom in, zoom out, and give you a sense of the 3 dimensions of the scan. So our participants, on the whole, were early career physicians, most in a group private practice. And unsurprisingly, many received deficient reports when it came to the referrals. Despite a majority of them owning Apple devices or using them in the clinical settings, a minority, a very small minority, knew that LiDAR was available on the iPhone or that what LiDAR was at all. Despite that, an overwhelming majority, when they compared 2D photography to the 3D scans, found them both to be very easy to use and interpret. And again, remember, basically no one had heard of the technology beforehand. When it came to considering adopting this technology, our friends in academia, of course, were reported to be more likely to adopt it for post-operative wound checks as well as for preoperative assessment. So, taking this all together, again, this is a pilot study. We had 37 participants, mostly early career physicians. But what I think was hopeful is the fact that despite the fact that almost no one knew about the technology, almost everyone said that it was easy to use as well as easy to interpret. And for me, that's very hopeful, especially, maybe our friends in academia will be able to pick it up and run with it with some future studies. So, of course, every good study has its limitations. Ours include the fact this is a pilot, this is a survey, and this is a cross-sectional study at best. And of course, the fact that LiDAR is not as well, may not have made it into the zeitgeist may affect how individuals responded to the survey. So overall takeaways, don't get it twisted. I think the current technology we have for 3D imaging is fantastic, but it can be expensive. It can be cumbersome, it can be burdensome, and for those reasons, it's not exactly commonplace in the average clinic or for the average dermatologist. But I think everyone in this room owns a smartphone, and for that reason, as this technology continues to develop, this may allow us to democratize 3D imaging for patient care. And certainly, I hope that future studies will continue to look at all the domains in dermatology, surgical, cosmetic, procedural, medical, and even telederm to see where we can incorporate it with a focus on cost effectiveness, patient outcomes, as well as access to care for all of our patients. This is proof I didn't plagiarize, and I want to thank all of you for your attention, my co-authors, my mentor, Dan Siegel, my downstate, as well as the conference for having me here today. And I'll be happy to take any questions, comments, concerns, complaints, or donations.